My name is Andrew Wolfe. I'm a board-certified plastic surgeon practicing in Denver, Colorado with a focus on cosmetic plastic surgery. One of the more common procedures we do is abdominoplasty, and it's a procedure which is relatively straightforward. We're removing excess skin, we are removing excess fat, and tightening up the underlying muscle in the process. There are nuances which differentiate an excellent tummy tuck from a less ideal tummy tuck. Different things can be done by the surgeon to enhance the result, both in terms of the surgical result, but then also the surgical experience for the patient. One of the things that we have embraced as a practice very significantly is what's called a no-drain tummy tuck. And for those patients who have researched tummy tucks or spoken to other surgeons, most commonly a drain, a small tube, will be placed either through the surgical incision or through a separate stab incision, and what you end up with is a small tube that sits underneath the abdominal flap, and it drains fluid that would otherwise collect underneath that abdominoplasty flap. It's the way that tummy tucks have been done since they were developed 30 or 40 years ago, and it is in many cases adequate way to prevent a fluid collection. And the challenge of doing a tummy tuck is when you lift up that abdominoplasty flap, there's a large raw surface where you've got a muscle layer and then fat, and those two layers need to seal together over time. The challenge is that that doesn't happen overnight, and small skin cells, fibroblast cells, are creating a scar layer between those two surgical planes, but it can happen over days to weeks. And every time the patient moves, twists, shifts in bed, or gets up and walks around, those two layers slide against each other, and that breaks some of those connections, and fluid is secreted into that space. And so the drains are there to remove that fluid. The challenge is drains don't prevent the fluid from being secreted in the first place. Typically drains are removed after about a week, but that process is not yet complete. And so many patients, in the neighborhood of 5 to 10% of patients with drains, will present after their drains are removed with what's called a seroma, which is a fluid collection in that space. And they're annoying, they can be challenging to deal with. At the very least, they have to be aspirated with a needle, which is not particularly comfortable for the patients. They tend to come back, and in certain cases, if that seroma doesn't resolve, you got to take that patient back to the operating room and surgically remove that scar tissue to let those two layers heal together. And so, approximately 10 years ago, several surgeons came up with an alternative to drains, and the thinking was, instead of simply removing that fluid as it's secreted, is there a way to prevent that fluid from being secreted in the first place? And given that it is the sliding of those two layers together that causes fluid to be secreted, the natural way to deal with this would be to prevent that sliding. And so what you can do in doing a no-drain tummy tuck is, instead of simply putting the tummy flap down and tucking drains in, we quilt the flap down to the muscle layer. So as we're closing that layer, there's dissolvable stitches that go from the fat to the muscle, and as you close the flap, it quilts that flap down with 20 or 25 dissolvable sutures. And what you end up with is a flap that is really nailed down to the underlying layer. It doesn't slide around. So whether the patients are more active or less active, you don't get fluid secreted into that space. And as a result, you don't need drains. And if you go from a standard tummy tuck using drains with a 10% seroma rate, most of the data done on the no-drain tummy tuck shows in the neighborhood of 1/10 to 1% seroma rate. So you're talking about a 10 to 100-fold decrease in seromas. In addition, patients are more comfortable. You don't have these drains sticking out of the skin. Infection rate goes down because, again, you don't have this foreign body piercing the skin and leading up into the abdominal space. And so you have more comfortable patients, you have fewer infections, you have significantly lower seromas. At the same time, by advancing the flap and quilting that flap down, you take the tension off the closure because that elastic skin is brought out to length and nailed down, and so you can get what I think are significantly finer scars by doing the quilting sutures. So it's just another benefit of the no-drain tummy tuck. It actually boggles my mind that this is not done by everyone, because it's not as hard to do as it might seem. There's a learning curve to it. It adds a little bit of time to the surgery, but the results for the patients are incredible, and so it's something I would never go back to using drains.